survey are we most concerned about if you have a flail chest? Airway and breathing and ventilation. Yes, exactly. Okay, mostly breathing and ventilation because your airway obstruction should not happen. Mostly it's breathing and ventilation, right? So you have multiple rib fractures, right? Multiple rib fractures. And what happens, what does your chest wall look like? Okay, I see Alex doing this. So it's paradoxical chest movement, right? When you have a flail chest and you have multiple rib fractures, okay, you see someone have paradoxical chest movement, okay? Meaning that when you should take a deep breath in, your ribs should expand, it actually does the opposite, okay? It kind of does, like Alex was saying, a wave motion, okay? Does that make sense? Okay. Now, if you can imagine, right, you have a flail chest, all these broken ribs. What's beyond that? What's in that cage? Your lungs, right? So what are we at risk for? A pneumothorax, okay? So how would I know that the patient has a pneumothorax?
Unilateral, like,
Okay. Okay. What'd you say? Okay, so a midline shift. That could indicate what kind of pneumothorax? Tension. Okay, great. Now, what if there was a hemothorax? What could that also add to our problem? Hemorrhage, yes. Hemorrhage, circulation with hemorrhage control. We have to do that, right? Hemothorax means that there's blood in the lung where it should not be, okay? What is our treatment for all of the above? Chest tube, right? Tension pneumo, needle decompression, hemothorax is the chest tube. Okay, good.
I'm still looking at it.
Okay, so let's say that it's not a pneumothorax, right? And it's just a contusion. Just a contusion where it's bruised on your lung. How is your patient going to present that way? It does hurt to breathe, 100%, yeah. Absolutely. So do you think that they're going to be breathing adequately?
No.
Are they going to take deep breaths?
No.
No. Okay. So anybody that has a pulmonary contusion are at high risk for intubation, right? They're going to need extra help because they are not taking adequate breath. So their breathing and ventilation is at risk, okay? So again, we have to think about it, right? Make it make sense. You have all these broken ribs, what's in the cage? Their lungs, right? You're at risk for a pneumothorax, a hemothorax. The medical emergency is a tension pneumo, right? And then also that bruise. Contusions can happen anywhere, okay? You can have a myocardial contusion. You can have a lung pulmonary contusion, okay? Does that make sense? Questions about that? Okay. I feel like I'm pulling teeth right now, but we got this. Okay.
Got a couple more.
So, what? So, we are briefly going to talk about burns, but what I really want to focus on is I want to focus on the Parkland formula because this is the other part of your math that you're going to have to do, okay? So, I need you to review this, okay? I need you to go through yourself and review the difference between superficial, partial thickness, full thickness, and then full thickness that includes fat, fascia, and bone, okay? I need you to understand the difference. We used to do degrees back in the day, now we do this thickness business, okay? So, this is where we get to the fun part, right? I think it's fun. I uploaded this picture. Yay for you, you get this picture on your exam. Okay, so you don't need to memorize this. You will get this picture on your exam. What the point of the rule of nines is that this is going to predict the total body surface area of burns, okay? So, you will get this picture. How it works is you will be given a description of burns on the patient, and then you need to figure out what the percentage is, okay? So let's practice, okay? So let's say that we have both legs. So this, just so you know, this is the front of the body, and this is the back of the body, okay? So you'll notice that the front is 9, the other leg is 9, and then the back is 9 and 9. Okay, so a whole leg, circumferential, that means front and back is what? What's a whole leg?
18.
18, perfect, thank you very much, okay? And then a whole arm, 4.5 and 4.5. Whole arm, circumferential is what? 9, good, okay, great. So if I were to say that the entire right leg, front and back, is burned, and let's say the right side. Right side, right leg, front and back is burned, right arm, front and back is burned. What would be your TBSA? So this is 18, 18 plus 9 is what? 27, okay. Do you understand how I got that number?
Yeah.
Okay, so again, you will have this picture on your exam, and you'll have a description of the burns, and you will have to tell me the number associated with that. Yes,
So the front and back, like, you add them together, or it's just one?
you add them together.
So if you say front and back of the knee, it's 9 and 9?
Yes, leg, front and back leg.
Oh,
Okay, does that make sense?
Yeah.
And then we're thinking, right, we're using our critical thinking, so if you say thigh, what would be half of your leg? Like your full thigh?
4.5%.
Do you mean
Half of 9, half of, so your whole leg is 18, right?
Oh, 9.
9, okay, so 9 and 9. Does that make sense? Okay. It won't be that complicated, okay? I'm not gonna make it where it's trickery and it's gonna be like where I'm like, you have an ear, a right ear, and you have the left chin. It's not gonna be like that. It'll be straightforward, okay? Do you have questions about this? No? Okay. So, you have an extra PowerPoint that can also help guide you that I want you to take a turn. We don't really have a lot of time to talk about this, okay? But what I do need to point out with physiological change from severe burns is that all of these things are involved, okay? Cardiac, pulmonary, GI, kidneys, all of those things are burned. Oh, see, I'm tired too, involved, okay? So the take-home message with this is that the patient that's burned is in severe hypovolemic shock, okay? Severe hypovolemic shock. And so we can imagine, and that's why we're going to talk about the Parkland formula, is that we are going to be giving them large volume of fluids, okay? They need fluids, okay? So they are going to be hypovolemic. That's how their heart is going to be involved. Cardiac-wise, they're going to be tachycardic, hypovolemic, okay? The fluid is going to be where it's not supposed to, depending on their TBSA, how much of their body is burned. They're going to have edema. Okay, fluid is not going to be where it's supposed to. Lung-wise, it again depends. When you think burns with pulmonary, I need you to be thinking about inhalation injury. Okay, inhalation injury. I don't know how else I can be more clear. Inhalation injury. Okay, with burns, you need to be thinking inhalation injury. Anytime you see that you have someone that's talking about that they have soot or carbonaceous material around their mouth, their face is burned, their neck is burned, you need to be thinking they have inhalation injury and they need to be intubated, okay? Airway protection. How you look at burns is exactly how you look at trauma, okay? You are still utilizing the primary survey to treat a burn patient. You are using A, with cervical spine precautions, airway with cervical spine precautions, B, breathing and ventilation, C, circulation with hemorrhage control, D, disability, and then E, environment. It's going to change a little bit, right, because we have someone that's burned, but it's the same. Same assessment, same interventions. Okay, you cannot move on until you fix the other problem. Does that make sense? Okay. Let's see. GI with burns, you need to be thinking about, you have impaired mobility, right? You have motility. Motility, absorption is going to be a problem, okay? And then oftentimes you have a loss of mucosal barrier. That's one of the side effects of burns with GI. So again, these people, we have to feed them, just like everything, right? Remember I told you that's a theme. Perfusion's a theme, GI and enteral feeds is a theme. You have to feed these people, The problem is that they are going to be in a hypermetabolic state. So what their metabolic demands are normally are going to be heightened because they are burned. Okay, does that make sense? Okay, and then, right, we talked a lot about this. How I know that my fluid resuscitation has been successful is what?
Urine output.
Urine output. That's where the kidneys come into play. Okay, that's where the kidneys come into play. And then think about what type with these patients. What are they at risk for? Their skin, right, is your largest organ, and it's the one that protects you from the outside. They don't have any more skin because it's burned off. So what are they at risk for? Infection. Yes, they're at high risk for infection. They're also at high risk for thermodysregulation. They won't be able to keep themselves warm. Okay, so you want to go to a burn unit, that's another hot place. Okay, it's another hot place because people can't regulate their own temperature. Okay, but we have to make sure that we keep them warm. Okay, so they're immunosuppressed because they don't have that skin protection barrier. They're in a hypermetabolic state. Okay, and then they have altered thermoregulation. Okay, questions about that? No? Okay. So there's different phases. There's emergent, acute, and rehab. Emergent and resuscitative, this is where we have our ABCDE. Okay, this is where the primary survey comes in. This is where you're giving them fluids. Okay, you're giving them fluids. Acute intermediate, that has to do more so with dressing changes and helping them heal. Okay, that's where pain management is going to be huge, you guys. Pain management. Do you want to give someone a Tylenol or maybe an opioid if they're getting a dressing change from burns? Because they're burned. No opioid. Okay? Please know that burn victims are going to metabolize pain medication much faster. Remember, they have that altered rate of metabolic. Okay? They have an altered metabolic rate, and so you may need to give them more pain medication. Okay? Does that make sense? Okay. And then rehab is the aftermath. Rehab is making sure that they can function in this new life. It's gonna be a lot of psychosocial stuff, okay? A lot of psychosocial stuff, especially if they were burned on their face, okay? So again, acute intermediate is that 48 to 72 hour plus whatever weeks they're in the hospital, okay? It's going to be centered around infection prevention, right? Wound care is huge, pain management, okay? Early positioning and mobility. So if they have a hand that's been burned, you want to wrap each finger separately. Why? Why would I want to do that?
You don't want them to
Because
stick
you
together.
don't want them to be like this, right? You don't want them to heal this way. So you want to wrap things separately. So there's a lot of wound care and thinking that goes into the acute intermediate, okay? Again, emergent and resuscitative is those ABCs, E, A, B, C, D, E, and then that fluid resuscitation, okay? Questions about this? Okay, so let's talk about the Parkland formula. So I'm gonna give you an example and we are going to go through it together, okay? Okay. So we have an 18-year-old female, she's crying, okay? She reports pain from burns over her back, her buttocks, and both legs posteriorly. So let me go back to our picture so you have that. Okay, so reports from her, so burns over her back, her butt, and both legs posteriorly. Okay,
36%.
so we have her back, her butt, and both legs posteriorly. So first and foremost, what is her TBSA?
36%.
Okay, 36. So how did we come up with that? Break it down for me.
9% for back, 9% for buttocks, 9%
Okay.
for each leg.
Posterior, right?
Posterior leg.
So 9 and 9 is 18. This is the back,
Yeah.
right? Back right here, 9,
This is
9.
back and buttocks.
Okay, so 18 is 36. Okay, you guys tracking so far? Yes? Okay. So the Parkland formula is up there. Okay, this is how you would do it. So it's always 4 mLs. It's the volume. Okay, and she's 80 kilograms. Okay, so what we would say is 4, and it's not a percentage, it's just a whole number. Okay, so 4 times 36 times, this is a TBSA.
Okay, but not the percentage. You don't
Correct,
need to
not the
change
percentage.
the decimal.
And then kilograms is 80. She's 80 kilograms. Okay, so what is that? What's my total?
That's 140. 144.
What is it?
Oh, that whole thing
4
is
times 36 times 80.
11,520.
Okay. So in a 24-hour period, we're gonna have, what is it, 11,000?
11,520.
520. 11,520.
Thank you. I was hearing like 100 numbers. Okay, so in a 24-hour period, she is going to get 11,520 mLs. Okay? Okay. Does everyone, before I move on, understand how we got this number?
That's just a fluid.
It's just fluids.
Just fluids.
Okay. So this demonstrates to you how volume down burn patients are. This is a lot of fluid.
So you're hanging in a bag an hour.
You're hanging more than that, my friend.
I was gonna say.
Okay,
Is that 1,000?
So, before I move on, are we good?
Yeah.
Okay. So, in the first 8 hours, you are giving half of this. Okay, so what is half of that?
5,700. 700.
So in 8 hours first, what is it?
5,760.
Right, 5,760, okay? Now, if I wanted to know, so this is in the first 8 hours, you're giving almost 6 liters, right? Now, if I wanted to know per hour how much I would do, I would divide this by 8, and what would that be?
720.
720. So every hour, I'm giving this poor lady 720 cc's an hour. Okay, that's a lot. Okay, it's a lot of fluid. Okay,
So essentially
and
what
then
you're doing
in the second
About an
half,
hour,
the
yeah.
second half, I would give over 16 hours the rest, which would be 5,760, right?
Yes.
If I wanted to know the hourly, right, I would divide this by 16, and what is that? 360. Per hour. Okay. You will have to do math like this. Okay? Pay attention to what the question's asking you. Okay? Pay attention to it. So in the first 8, so the easiest thing that I would recommend doing, right, is to figure out what your 24-hour total is. Okay? Figure out what your first 24-hour total is. And then in the first 8 hours, it's half. It's half. Okay? And then I would also figure out what my hourly input would be in those first 8 hours. Okay, does that make sense? And then for this one, the rest of the time, because 8 plus 16, this is again in a 24-hour period, you would have the rest, 360 per hour. Okay? How do I know that this patient with all of these 11 liters, almost 12, right? I mean 11.5 essentially. How do I know that I fluid resuscitated her? Her urine output. Okay, good, perfect. Questions about how I arrived at this? Okay, let's do another one. Okay, so we have a 70-year-old male is coughing, wheezing, and I can't say that. Coughing up our carbonaceous material. His voice is hoarse and responds to only painful stimuli. Okay. There is erythema, blisters, and charred skin on the anterior chest and abdomen walls, and circumferential burns of both thighs. Okay, so let me say that again. Okay, so he's hoarse, only responds to painful stimuli, things are not well for him. He's coughing up carbonaceous material. He has erythema, blisters, charred skin on the anterior chest and abdomen. Circumferential burns of both thighs. Okay? And he's 110 kilos. So let's break it down. What is my TBSA? What?
40.5.
Okay, how did we get to this? How did we get to that?
Is it not 37?
So, abdomen, chest and abdomen, right? Chest and abdomen, okay?
Is that
Chest
one?
and abdomen is what?
18.
18, okay, perfect. So we have 18, and then circumferential thighs.
So thighs, like,
So
completely
the
of the
full
thighs.
leg, right, the full leg is 18. So if you had half of it, circumferential thighs, 4.5 and 4.5, right? 4.5, 4.5, 4.5, 4.5, 4.5. You could also just do 9 and 9, right? Because it's circumferential. 9 and 9. Okay, does that make sense?
36.
So it's
36 plus 6.
36. Yes,
Circumferential.
it's 36. Does everyone understand how we arrived at that? Yes? This is harder than your exam. Don't worry. These are harder than your exam, okay? So, 36, right? So we did
Is
36.
the face not included because of the,
I just talked, I never said he was burned on his face, right? But he is coughing up carbonaceous material, he's wheezing, right? So that can tell us what?
there's airway involved?
Listen up, guys. Airway. The wheezing, coughing up carbonaceous material, right? I didn't say he was burned on his face,
Okay.
okay? So again, with that gentleman, we are worried about airway, okay? Anytime someone's coughing up any sort of carbonaceous soot, right, black stuff, we need to be thinking about airway. Just like with our spinal cord injuries, the longer we have an inhalation injury that you don't have an ET tube in, the harder it's gonna be able to go because of that swelling inflammation, right? Anybody ever see that Grey's Anatomy, right, episode that we talked about, right? She's talking
Yeah.
in 1 minute, next minute they can't get an airway because it's closed up, but she was fine, right? That's what inhalation injuries are. Anytime you suspect one, intubate them. Okay, so we talked about, we came to 36, right? So 4 times 36, that's our TBSA, and then I said 110 kilos. So what is my total 24-hour total? So 4 times 36 times 110. 15,840. Excellent. Okay. So in the first 8 hours, okay, what am I giving? It's half, right? What is half of this? 7,000 what?
920.
Okay, great. So if I had to do an hourly situation, what would that be? So divide by 8.
990.
900 what?
990.
990. Wow. mLs per hour. Okay? And then the rest, 16 hours, right? Okay, that's so great. It's the rest. So that's another the half, right?
495.
Divided by 16, 495 mLs per hour. Okay, great. Questions about how we arrived at this? No? You guys doing good? You want to practice one more?
Sure.
Okay, sure. I'm forced to, sure.
Sure, why not?
Okay, let's do 74-year-old female, arms, face, back, and chest. Arms,
Front and back.
front and back, front and back, yep. Front and back, face, back, and chest.
So, 9, 18, 1, 2, 3, 4,
Arms,
36,
face, back, and
plus
chest.
4.5. So 36
What's my
plus
TBSA?
4.5.
45.5.
40.5.
40.5, yes. 40.5.
45.
And let's do 75 kilos.
You just
75
made
kilos.
46.
So 4 times 40.5 times 75 is what?
12,150.
12,150. Excellent. What am I giving in the first 8 hours? 6,000 what? Perfect. Excellent. And then what is that in the first 8 hours hourly? What am I giving?
760.4.
Perfect. Good. Do you understand how this works? Okay. Again, the easiest way to do this, so you do not get confused. First, do your 24-hour total. Your total. Okay. Then write this out, you guys, or you're gonna get confused. I can guarantee it. Okay. Write this out. So in the first 24 hours, you're giving this. In the first 8 hours, you're giving this total, and then figure out, even if the question's not asking it, figure out what your hourly input is. Then the second half is 16 hours. Again, it's half, so 5,007 is the same number. And then find out what your hourly. And then read your question. What is it asking me for? Is it asking me for the total number in the 8 hours? Okay, or is it asking me the hourly? Okay, does that make sense? So again, your math for the burn section. You will have this picture, this detailed picture, rules of 9, okay? You'll have straightforward instructions as to what I'm talking about, okay? And then you will have the other math is the Parkland formula, okay? Figuring out how much fluid to give. Does that make sense? Questions? No? Okay? Okay, so, you will take your exam today at 15:30. Please do not wait until 4:30 to start. Okay, you'll have 102 minutes, 58 questions. I am available to you. If you run into any sort of situation, take a deep breath, email me, we will figure it out together, okay? Make sure you're doing an environmental scan. You don't want me to email you and ask you if you were cheating. That's not what we want to do, okay? So make sure you're doing a thorough environmental scan, okay? Yes, it records you, just be aware of that, okay? If you talk to yourself, that's fine, but make sure you're alone if you're talking to yourself, okay? Your next test will be on Monday, okay? It will be here, okay? I wanna say, I think it's like 58 or 57, maybe 56, I can't remember questions. Okay, it's going to include neuro, trauma, and burn. I'm going to alter the number a little bit to include more neuro because we spent more time on neuro, okay? Does that make sense?
Yeah.
So less on trauma and burns, more on neuro, okay? But you will still see this math, okay? You'll still see rule of 9 math and Parkland formula math. Okay, the other math with neuro is the math calculation, math minus ICP equals CPP. Yes?
Are the quizzes that you have already posted for those, do those include some of these calculations in there? Or will you
Yeah.
provide- Okay.
Yeah. There should be, these calculations.
Talk about
Yeah,
DI
absolutely.
and
Yes.
SNDH and all.
I see community illness outbreaks on the subject guide. No?
No, thank you for reminding me. Nope.
What about
Okay.
DI versus AI?
So like none of like, the Ebola and, all the other bad
And
community things.
the DI and SIDH? No?
Yes.
Yes.
DI and SIDH, yes. Please make sure you go over that. That's neuro.
Okay.
Okay, that's neuro. Look at your subject guide. Spend some time on that and make sure you can speak to each of those categories. Okay? Reach out with questions. Happy to help. I'm available to you. Okay?